The World Cities Project started about 10 years ago as an effort to look at the four largest cities in the developed world: New York, London, Paris, and Tokyo. The idea was that these cities have been studied quite a bit by urban planners, by architects, by people who look at transportation systems, people who are concerned about economic development, because these are special places, they are hubs in the global economy, and also because they're quite comparable cities in many ways. They have large, densely populated populations. They have economies that are very similar. They're centers of medical excellence. They're centers of finance and technology. But no one had ever looked at health and social policy or health and social systems within those cities. So we started out actually with an effort to compare how each of these cities was coping with an aging population, both in terms of providing health and long-term care. Our subsequent work has really used, three of the four cities, New York, London, and Paris, as ways of illustrating the consequences of national health policy for cities, and also looking at the ways in which these various cities, through their public health systems, were trying to improve the health of their populations. And so we've looked at access to primary care, access to specialty care. We've looked at avoidable mortality across and within these cities to address questions about geographic inequities in health, access to care, and just the financial consequences of insurance coverage in the different cities. And one of the things we see very clearly, or two things we see very clearly, are number one, there are huge problems that are created not only for the populations of those cities in terms of their health burdens, in terms of the financial burdens of paying for care, but also for city governments themselves because of the huge gaps in coverage that we have in the United States. So whether it's a national health service or a national health insurance system, what you see in London and in Paris is not only do the population overall have better health, although there are certainly major health problems in London, but the city governments don't actually invest nearly as much in promoting the health of their populations as New York. New York as a city is arguably doing much, much more because it's continually fighting upstream against the problems created by the national policy context. That's the first point. The second point is that there's more than one way to do this. The French and the English systems are organized in very different ways. The hospitals in England are mostly public hospitals within the NHS with a very small private sector. In France, you have lots of private hospitals, nonprofit and for-profit. The GPs are contractors of the NHS, even though they're private. In French, it's mostly a private delivery system with lots of solo-based office practitioners. And so the delivery systems are different, the financing systems are different, but in both of those places, everyone is covered. Care is, if not free at the point of service, because there are out-of-pocket payments in France, the financial burden is significantly reduced. And in both of those countries, and this gets back to medical education and workforce issues, at least half of the physicians are in primary care. If we look in New York and contrast to London or Paris, 2/3 of the physicians are specialists, and there are consequences of that. And so those are two big lessons that I think are very important for U.S. policy. Hi, I'm Michael Gusmano. I was trained as a political science, and I'm a research scholar here at the Hastings Center.